The federal government has revealed that Nigeria loses between 13.3 trillion naira and 17.9 trillion naira annually in direct and indirect costs due to hepatitis. The government also said 4,252 Nigerians die each year from liver cancer caused by untreated hepatitis. The coordinating Minister of Health and Social Welfare, Professor Mohammed Pate, said this on Monday at a press briefing in commemoration of World Hepatitis Day themed hepatitis. Let's break it down. Pate, who was represented by the Director of Public Health at the ministry, stated that Nigeria has the third highest burden of hepatitis globally, with over 20 million people broken with the disease. For more insight, we're joined by Chairman, Chidicon Medical Centre, Dr. Philip Njemanze. Dr. Njemanze, many thanks for joining us. What are the predominant types of hepatitis? Is it A, B, C, D? And how does it contribute to healthcare? And really just, what are we looking at in terms of mortality rate and the prevalence in Nigeria?
Yes, the major forms are B and C. These are bloodborne. That means you contract them through blood and body fluids. So that's why they are of major concern. The prevalence varies from different statistics, from 8.1 to about 12.2 across the country. 1 in every 8 persons is somehow affected by this disease. The major concern is that there is little awareness. So most of the people who have the disease don't even know that they have the disease. So there is little awareness about this condition. And many people can carry it for a very long time because the symptoms don't manifest and only manifest later. But one good thing going for us is that vaccination works in this case. We have both a monovalent vaccine, that means only one, and so you get them at birth and then repeated 3 times, and these injections work very well, the vaccination. And then you have the Penta, is part of other vaccines put together that are given at birth. So it is possible to do a lot to prevent and treat this condition. However, the lack of awareness is one great impediment to good health in this area. Now, one thing that happens is that the common habits we have and certain traditional practices like circumcision, female genital mutilation, practices like even having a nice haircut between successive people, sexual practices, exchange of saliva. So these are the things that could transmit this condition. And people will carry this over a long time and leading to a condition of chronic hepatitis. So what we need to do, and one thing good about this campaign, when we say in this day of hepatitis, to create greater awareness in the community. One life, one liver. So you really have one liver, and that's the factory of the body.
Right. So
if we can educate people on self-awareness and going to the medical centers to get tested, because it's pretty easy to get tested, and then once the person is positive, then the medical doctor will look at the condition and advise and counsel the person on what to do. Those that are negative can still get a vaccine.
At this point, one has to think about this from the primary care healthcare level, right? Because if we're looking at a mortality figure of about 4,252 persons annually, and also looking at a loss of about over 17 trillion naira, it begs to ask the question about the importance of primary healthcare facilities into when it comes to transmission and also early detection, as well as managing and educating the populace. What are the gaps? What are we looking at in terms of gaps, and how can our Ministry of Health fill that gap so that we can reduce that number and, most importantly, not lose lives?
Yes, one of the major things that can be done at the primary healthcare level, most of our our people are rural people, and they get their basic care in the primary health care centers. And some of the deliveries that take place there use sometimes, unfortunately, there could be unscreened blood because of the emergency situation or because the materials are not available. So I think what we should do is to have a national blood transfusion policy that makes sure that there are centers that can get screened blood to the remote centers. This is being done in small countries like Rwanda, where they use drones to deliver blood to rural communities. So if we had such a functional system in Nigeria, that the federal ministry and then of course the state ministries sponsor centers that can, on emergency call from any rural community, any rural doctor at any primary center, both public and private, they can send screen blood through drones to be delivered to these communities so that they can get blood, because blood transfusion would be a very important part of spreading this infection. If mother is infected, of course the child will be infected. So that is one gap that is there and that we can plug easily with the use of modern technology. And this can be done because Nigeria has really the infrastructure to do this. We have a very good network of cell phone distribution networks and mass that we can use to collect this information. Where is this blood needed? Instead of making the long trips looking for blood and unscreened blood, we could actually send this blood that is screened from blood banks in city centers down to the remote community using drones.
Right. Doctor, I must also talk about something that we have to bring to the fore. We saw an issue rise amongst those living with HIV and AIDS, where we saw the cuts with the USAID funding from the U.S. into Nigeria. One of those fundings used to go to, HIV and AIDS and, antiviral drugs and all of that. Is there a correlation here? Do you see those funding also affecting those who are living with hepatitis B or C or D or E? And are there issues that need to be raised concerning, cuts of donor fundings to this type of communities and individuals?
Yeah, I think we are giving too much value to the donor funding. This donor funding was playing far much less role in the overall healthcare. Though a lot of noise is made about it, but I think we should de-emphasize the importance of this donor funding and actually come up with our own. The health system is ours. It's a national asset, and it's a matter of national security. And it shouldn't be a sector whereby all commerce affair, any donor comes in and puts in money wherever he wants for whatever program. So I think we should emphasize the importance of this. And I don't think that USAID had a significant impact on the health system, despite the noise and a lot of money that is being made about it. In real terms, I don't know of any real significant program apart from the PEPFAR program, which was sponsored by the US government to some extent to provide drugs for HIV and AIDS. And we should be able to cover this gap with what has been done by the federal government. I don't think it has a significant impact on the provision of healthcare and awareness building with regards to hepatitis B and C and all the other infections.
All right. Well, I must say thank you, sir, for joining us. They're just really going in depth into this as we, commemorate World Hepatitis Day. Once again, thank you, Dr. Philip Njemanze. He is the director at Chidicon Health.